I asked a question on notice from after the last estimates, which led to the advice that there are 1,476 doctors certified to prescribe mifepristone, RU486. So my question is, of those doctors, some might consent to their names and practices being published to improve access to medical terminations. And I'm wondering what barriers there might be to publish a list of such doctors, and do you think that it would be helpful to assist women who are seeking medical terminations?
I think the department would need to very carefully consider our obligations under, I think it's Section 135 of the National Health Act, where it is actually a criminal offence to reveal information that we collect for the purposes of administering the PBS basically in a way that's going to disclose individuals, whether it's doctors or patients. However, I suppose there'd be nothing to stop those practitioners themselves advertising that they are available and have completed the training and can prescribe those medicines.
Yes, you haven't quite answered my question. I didn't use the word consent. So if the doctors were to consent to having their names and practices published in order to improve access of women to medical terminations, the logical publisher of that information, of those doctors who consented, would be the department, I would have thought. Now, there would be no barrier, no legal impediment to that occurring if they consented. What would be the any other barriers? Well, no, in terms of privacy, there'd be no barrier.
I'm not sure, Senator. I would need to seek advice on the operation of that provision in the National Health Act.
What I would like to know is, number one, whether there are any other impediments to the department doing that, and number two, does the department acknowledge that might actually result in increased options for more women?
I suppose the other factors we would need to consider is the costs to the community of the government supporting the publication of that information on government information sites, the costs of making sure that that's kept up to date when there are so many practitioners who may change their circumstances, and so we'd probably need to look at other options for that information to be made public, including through direct advertising by the practitioners.
Yes, all right. So if you can accept that on that question on notice and respond accordingly, and you can certainly include that kind of consideration. Thank you. Thank you, Chair.
Excellent, thank you. Very prompt as always. Senator